Okay, good afternoon, everyone, and welcome. This is a support call for home care and hospice providers throughout Mississippi and Louisiana. And today we're going to be focused on Mississippi sheltering. So thank you, Miss Smith, for being with us today. But before we get there, I just have a few things to say. The peak of hurricane season is uh, September 10th, and we're approaching that. And as you can see, we have three little systems out there that we are currently monitoring throughout Louisiana and Mississippi through the Gulf Coast. Um, I want to thank Mr. Chad Brownlow with the Jackson County Office of Emergency Preparedness. He sent us some great links for hospice and home care to consider in terms of getting some of the resources and material to your patients. These are really great links for emergency preparedness, not only in Mississippi, but also in Louisiana as well, and throughout the entire country. This is the FEMA site. The American Red Cross has a number of links related to emergency preparedness and checklist and making sure you have everything that you're going to need for older adults and your pets as well. And then also Mississippi Department of Transportation and Mississippi Department of Health also have some important links. So I'm including all of those links in today's session so that they're all of the hyperlinks are actually working. So after today's session, I will be taking this, turning it into a PDF and putting it into next Wednesday's calendar invite that will be going out to everyone. And so you should be seeing shortly after today's call an email just announcing that there's that PDF available to you. We're also recording this session, so folks that can't be with us today can still hear this message about sheltering in Mississippi. And I want to remind everyone that we have a lot of recordings related to emergency preparedness around hurricanes, and all of these links take you to those recordings. We're still before the peak of hurricane season, and there has been an update in Dr. Kazenbach's predictions about hurricanes this year. He's dropped them by one. That's a good sign. Good sign. And we are going into the peak of hurricane season on September 10th. And I pulled these charts down from Dr. Kozenbach just to show you the predictions in terms of the human predictions and also AI's predictions for the next 2 weeks in the Atlantic and Gulf. So I was just curious that they're now allowing AI to also, all of the experts to get together and they plot they use different models to plot where they think in the next 2 weeks will be at the Colorado State University. But then they also used AI to generate, and they're not that very different. So it's going to be interesting to see the role that AI is going to play in weather prediction, especially during hurricane season. But uh, they are only putting out 2 week forecast right now. So this is for the next 14 days as of this past Monday. Yes, I took these down on a Monday or Tuesday, and it gives 2 weeks. So we'll be looking at those over the coming weeks, especially as we get into the peak of hurricane season. And I just want to remind everybody that it's hot out there, y'all. Make sure that you all are staying hydrated. Make sure your patients are staying cool and staying hydrated, and that they're not suffering from heat exhaustion or heat strokes in their own homes. The last thing we want to do is have home care patients, hospice or home care patients, have to be transferred to the hospital because of heat. So are exacerbating whatever their chronic condition might be. So keep that in mind when you're doing your home assessments to make sure that you are being sensitive to what the temperature's like in those homes. So having said all of that, I have some points along that. I'm not going to go into that. We went into that last week. What I'd really like to do is turn it over to our friends from Mississippi State Department of Health to talk about sheltering this hurricane season. We're talking primarily in Jackson County at the shelter on the coast, correct, ladies? Okay. Well, I'm going to let Ms. Smith take over. Do you have any slides that you want to that
I
you
don't
want?
have any slides. I was just going to talk about some of our processes and procedures and what we can do.
Yes, ma'am. Yes, ma'am. Well, I'll turn it over to you to lead us through this sort of this discussion about sheltering in Mississippi.
Okay, good deal. So I'm Candace Smith. I'm the director of the Division of Strategic Planning and Response within the Department of Health, which we're responsible for all of the emergency preparedness and response activities that occur within the Department of Health. Um, we are the ESF8 leads with the State Emergency Operations Center, so we handle everything public health and medical services for the state of Mississippi. We have, everyone knows, our fixed medical shelter in Stone County. We have that facility that is most used during hurricane season. It's there all year and we keep it maintained. We could use it for anything, but it becomes a hot topic every year about this time because it's a resource where we can open up a actual medical shelter. In other parts of the state, we work with other entities and or general population shelters to establish medical needs. But in Wiggins, we can actually stand up and staff a medical shelter. Some things to point out is the medical shelter is only opened at the discretion of the governor, the state health officer, or a direct request from a county emergency manager through MEMA. So it has to be the county emergency manager has a need in their county that's identified, most likely from a home care or hospice entity saying we have these patients that live at home that they don't require hospital care, but they need some type of thing because we have an evacuation. That request has to go through the county emergency manager and they request it through MEMA, or the governor or the state health officer says, hey, there's a need and we need to open it. Those are the only three ways that that can be opened. We, as the division within the Department of Health, cannot make that decision, cannot open it if it does not come as a direct request in WebEOC or from the governor. So we always are communicating with the county emergency managers when there is impending weather in the form of a hurricane. So when something enters the Gulf and we start having meetings and discussing what's happening, we are in communication with those county emergency managers and we do let them know at what point we have to say, hey, if there's no need and you're not requesting it, this is our cutoff for a pre-landfall activation. It takes us ideally 12 hours. It probably takes a little bit longer than that to get it fully stood up and ready to go. We staff it with staff all across the state, so we have to have time for them to travel. So usually we're going to say our cutoff is at least 1 day prior to landfall because we don't want our staff traveling through the outer winds and things like that to get there. We also don't, ambulances can't travel and other modes of transportation to get the people there can't travel in those type of conditions. So, um, a lot of times we don't have a lot of lead time with a hurricane when it comes into the Gulf. So the likelihood of a pre-landfall activation is a lot lower just because of the time it takes. Does not mean that it cannot be opened post landfall if destruction and damage is more than what they were predicting. Um, we do also partner very heavily with um, Department of Human Services, American Red Cross, Salvation Army, whichever one in those counties actually manages the sheltering, and it kind of varies from county to county who becomes in charge of those shelters. It all starts with the Department of Human Services. Most counties immediately turn it over to the Red Cross. But we do keep in coordination with that through ESF 6, so Emergency Support Function 6 within the State Emergency Operations Center is mass care. So that's where you'll find when we sit in the EOC in Jackson as the Department of Health and ESF 8, so does Department of Human Services, Red Cross, Salvation Army, all of those things that also can help with regular general population sheltering. So we actually send, if safe, or phone call within those shelters and perform medical evaluations to make sure there are no unmet medical needs. So in that, we can determine if someone's in there and they don't have their prescriptions or they don't have their medical device that they need. We identify that and we can help them get that and make sure that there are no unmet medical needs that might require a medical shelter. So we do that with all open shelters during any type of response, not just hurricane. That happens with anytime there is a general population shelter open. One thing to note, there is a difference between a shelter and a safe room or a cooling center, warming center. Verbiage kind of changes. A lot of counties are using verbiage like safe room, cooling center, things like that. Those are not considered shelters in Mississippi. So they are not treated as a shelter. And they don't go through those processes, and we don't always know about them. So if the county is opening up a safe area for people to come and they're not calling it a shelter and listing it through Human Services or the Red Cross, we don't know it's a shelter, then therefore we don't know to check for unmet medical needs.
Right.
So this is something we ran into last year during Francine. We had lots of shelters open in the lower three counties, but we also had several cooling centers, safe rooms, things like that open. And there became a lot of confusion on what was the shelters and what was not. Um, it's something that I hope MEMA has fixed prior to this hurricane season in the way that these are advertised. Um, MEMA puts shelters on their website, but they don't always put
The cooling.
shelters real time on their website. So it's very, very important that as a home care or hospice entity, that you are communicating with your county emergency managers on what is available for your patients. Because they are more than likely, unless it's a bad storm and they're having to evacuate, not going to lean to a shelter. They're going to stay more on a safe room, cooling center type of thing because they don't have to provide food, they don't have to have sanitation inspections, and they don't have to have some of those things. And if the Red Cross, if there's already been other storms and the Red Cross is really taxed, then they're looking at the county to run it if Red Cross can't step in. So it's a lot of availability. So if there's lack of availability, say we're later in the season and there's been more storms in other areas and the Red Cross doesn't have as large of a database to pull from, we start seeing less shelters and more of that. And those don't get the correct information to the state level for us to know that there could be medical needs.
Okay.
Okay.
Well, let's stay with your Stone County
Okay.
medical needs shelter in case, the next 6 weeks or so, we really see an active season and we get some activity. Hopefully it'll stay in the Atlantic as we saw in those charts. That's our big goal. But say we do get some Gulf activity. The shelter would be open to folks that have particular medical needs, or is there a triage? Is there is there a checklist or something that folks have to be triaged into this, or can the emergency managers just send a patient there? And I would think it's a patient with a caregiver, correct?
Yes, so we can house a patient and one caregiver is how we're set up.
And you
And
caregiver to go with the patient.
mhm,
You'd prefer someone to be with that patient rather than that patient coming alone, correct?
yes, yes,
Okay.
we do prefer there to be a caregiver with that patient. It just makes treatment very much more seamless.
Yes.
We obviously, if they don't have a caregiver or their caregiver can't come, their Um, the emergency managers in the lower three counties and basically the lower six, so Jackson, Harrison, Hancock, Stone, George, Pearl River, all have a mechanism within their EOC to perform the checklist that's needed for entry. So they have a standard that they look at that we provided when they get to the shelter, we do a little bit more thorough inspection to make sure that they're not too sick and actually need to go to the hospital. But they have a questionnaire that they use to determine if they actually meet the criteria for needing medical sheltering in Mississippi.
Okay.
Um,
But in each county, does it slightly different, or is
They
it
were all provided the same information. They might ask the questions a little differently.
right? Okay. Okay.
Depending on, and a lot of it depends on who is running their local shelter. So if their local shelter is Red Cross, then the acuity of care that Red Cross can handle is higher than like if their Department of Human Services is running it from the county.
I
So
see.
it really depends on who's running that shelter as to the acuity that they can handle, um, which is why we let them determine the need. So basically, what they do is if you have, so the main thing to know is if you have a patient that is in an evacuation location or not and needs to get out prior to landfall, and you think they have what would need a medical shelter, not a general population shelter, but they don't need the hospital, the county emergency manager is who they're going to call. And
Mhm.
they're going to determine based on what they either already have open or are planning to open if there's the need for a medical shelter. So they kind of make that determination. And I know that works differently than how it works in Louisiana.
Right.
So there are differences there. Some states have an at-risk registry. We do not. Um,
Those 6 counties, they do get a
we
report every week
Right.
from.
We have the at-risk registry that comes through y'all, but some states actually use a registry that the county's citizens can register for to know that they need medical sheltering. But that is decided at the county level. That's not a state directive. Um, we have talked about that and tried to think about how we might could implement something like that to know a little bit more about the need. But we have not had much traction there. Um,
Maybe we can
they
work on
want to
that.
keep it.
Maybe we
They
can
want
work
to,
on that with
yeah,
y'all in terms of getting the address. The address registry is a really great tool for
yeah,
agencies to be able to identify and send that information to the emergency managers
right.
in their respective counties. How many people can the Stone Medical Needs Shelter hold?
150,
100 and
150.
is that 150 people or 150 patients?
Valerie, I don't want to misspeak. Valerie is my training coordinator and helps me a lot with the shelter stuff. So I do not want to misspeak. Is it 150 people
It's
total?
150 total, not including staff.
Yeah,
Exactly. So it'd be
So
75.
75 patients with 75 caregivers is what
Yes,
you're talking
yes.
about.
yes,
And uh, when hospices are putting patients on a special needs shelter, yeah, and if there is something and it does open up, what should patients come, you said there's no food being provided?
Food would be provided, yeah,
At
at our shelter, yeah.
at the
Everything
shelter.
that they need as far as food and that kind of stuff would be provided. If they have certain medications, they would need to come with those. Obviously, if it's a post landfall thing and they don't have them, then we use our other means
Yeah,
to
that,
help
yeah,
get
so,
that. That's a
but
different
but
situation.
like if a patient is on oxygen, should they bring their oxygen concentrator so that they can plug it in rather than, the tanks are good for hours as opposed to there would be electricity. In other words, there's backup generator. I mean, there's a generator for
Mhm.
the shelter and all those things that would keep electricity flowing. You would encourage people to bring their DME equipment with them.
Mhm.
Okay.
Yep. We do have oxygen on site and we can hook them up to the regulators on the wall
So,
if they're on oxygen. So, but we do encourage them to bring their concentrators that way if they need it to like go to the restroom and things like
right,
that,
right,
have it.
right.
We do have backups and we have, means in place for that.
Mhm.
But we always encourage everyone to bring all of their DME equipment plus all of their medication. It just makes treating them a lot easier, especially if they're familiar with it and their caregivers familiar with it. It just helps with what our staff can do based on orders and things like that. If they come with it, it's better.
I didn't pull this week's totals for those 6 counties, but I pulled it last time when we looked at District 9. I think we identified at that time about 50, and this was probably a month ago, but about 50 patients that would need assistance, that were
Okay.
identified as being needing assistance to get out of harm's way and would probably end up in the medical need shelter. You said something earlier that I want to go back to. You said that we want to make sure if they're that they meet criteria for the medical need shelter, but if they're too sick, they would go to the hospital. Um, and I bring this up in every region that that we've been having these discussions. Um, when when whenever there's a tropical system coming our way, inevitably, there are going to be hospice patients that are in the process of dying. I think statistically, it looks like there are about four. I think it's 4 patients per a day in hospice along the coast that pass away. Um, and so when a person is actively dying like that and land falls within 72 hours, those patients we could put into a local hospital. Those agencies would be able to refer those patients into a hospital setting as opposed to the medical need shelter.
Possibly. And that's where we with the Department of Health can help with that. Being the regulatory body of licensed healthcare facilities, if we have a patient that we need to place in a hospital, we can help assist with that if that's where they need to be. Lots of factors go into that because, a lot of times if there's an impending threat, the hospitals are decompressing and looking
Yeah.
at potential evacuations as well. So it might be that we have to place them in a hospital a little bit further inland just to, help, but we can help with that because that's part of the overall process that we're looking at when we're talking about there's storms coming, there's evacuations ordered from the locals, things like that, what facilities are staying, what facilities are not, because we have to know what facilities we immediately have to check on after landfall if they stay, and what their census is and things like that. So that's something that on the front end at the State Department of Health that we're heavily focused on. And I think that's the bigger picture is as the State Department of Health, we have so many responsibilities when there's a storm coming. Medical sheltering is just that small little piece that we deal with.
Right.
But using what we do with that shelter especially when it comes to homebound patients. So, like the shelter is not available for a nursing home that needs to evacuate or
Exactly.
assisted living that needs to evacuate. It is just for patients that are at their homes. So for y'all, with being home health and hospice, that it is a benefit to know that it's there and know the process, because if you need it, we want it to be used if it's needed. You know, a lot of times people don't want to go to a shelter. I get that. It's not just the easiest environment, but a lot of times that might be their only option, especially if they are codependent on caregiver and, you know, home health or hospice services. But if they are in that active stage, that's something that we could discuss with that entity and help try and find the best placement. Each of the lower three counties, so Jackson, Harrison, and Hancock, staff their EOC with an ESF8 lead. And a lot of times that is somebody from our staff that's there that helps coordinate anything public health medical services. So we do play an active part in the local EOCs during a response as well to kind of help bridge whatever we need to help with.
I got a call, you know, we operate we maintain the at-risk registry, and the agencies along the coast in Mississippi do use it to identify and communicate those patients with the emergency managers. I got a question yesterday that I answered and then started thinking, well, I know that that's true in Louisiana, but I'm not sure if that is true in Mississippi. But the question came about a particular assisted living facility. And they were saying, shouldn't those patients be on the at-risk registry? And I said, well, it all depends whether or not the facility is licensed or not. If it's licensed, at least in Louisiana and in some other states, they have to have their own evacuation plan for their residents. Whereas if it's unlicensed, then it's usually private pay, and they aren't under the same obligations or responsibilities as a licensed facility that's receiving Medicare or Medicaid funding. Is that
A little different in Mississippi because
you-
everything, everything that is personal care home, so that's assisted living and independent living, licensed or just certified, have to have an emergency operations plan with evacuation locations pre-identified that are not the medical shelter. They are another entity, a church, whatever. They have to do that. They have to maintain that. That is part of their, so all assisting facilities and most independent living, unless it's like a retirement community and they just have like apartments, are licensed in our state. So to get their license every year, they have to have their plan, and their plan has to be updated every year. So we basically hold them to the CMS standards.
Okay, that's what I want. So if they're licensed, or you said certified.
Yeah. So some of our facilities are just certified in our state. And I don't know without looking up the specifics when it comes to the assisted living side of it. Most of them are licensed. I know there are some when it's like an apartment type thing, they're not licensed or certified. So like if they
The
could
rule
be
wouldn't apply. The rule for being responsible for their evacuation don't apply to them.
Right, because we don't see their stuff. But if they are licensed or certified, they are held to the CMS standards in our state. Those become the CMS is like the base standard, and we have other things higher than that, but the CMS standards are the base. So no, those facilities shouldn't be on the at-risk registry because they have to have their own plans. This is more for outside of those.
I was right. I did not know about the certification listing. I knew about the license, but I didn't know about your certification system. So both licensed and certified facilities have to have an emergency plan that they're in charge of, and they would not go into our registry if they're unlicensed or uncertified. And those patients can go into our registry.
Yes,
Okay.
that'd be correct.
Right. Ms. Brewer, hi. Hello to you. Do you have anything to add to the conversation in terms of what we've been talking about in terms of sheltering? Anything you can think of that we have not talked about?
I think Candace pretty well covered it all.
Yeah, I have a much better understanding of sheltering in Mississippi than I did prior to
Dude.
today's call.
Well, that's great. I'm glad. And
Uh,
we have not opened our shelter in many years. Okay.
it hasn't been,
It has not been requested, which
that's.
we did have a potential request last year with Francine pre-landfall, but they couldn't guarantee it, and they were like, "I'm not sure if this person's really going to come." And I was like, "Well, you have an hour to decide, and it's like cut off time because we can't get there and get it set up and all the things." Never came through. Never needed it post-landfall. So it's really been 2020 or 2021 since we actually opened and had patients, but we know there's a need for it at
Yeah.
times. And
Yeah.
I really think if we
Just never
could,
know when the time is going to be.
right, if we could have some further discussions about the at-risk registry and how we can kind of link those on the front end, that would give us a really good understanding because we used to staff 42 staff to open it. We have cut that back to a scalable model where we start with 24, and we can build up staff if we get a lot of patients and need to do that. But it comes to we were sending more staff than we had residents, and it just wasn't feasible. And it's also really hard to staff 42 people from across the state when something's going on. So we kind of have scaled that back and kind of cut back on what we need to initially open it. But if we kind of knew, okay, if we're looking at a landfall that impacts more Jackson County, this is the number that we could be looking at just from the at-risk registry, and maybe work to promote that through the EMs where they can help spread that, because that's what partners in Georgia are doing. So they have really beefed up their at-risk registry with their locals and have the locals promoted and they maintain it so that they know on the front end. It's not an exact science because you're going to have outside, you're going to have others that come through there, but it's at least a planning mechanism that we can use to know, okay, if we're looking at a landfall here, we're looking at needing about 25. Okay.
Mhm.
But if we're looking at Harrison County and Harrison gets hit, but Jackson also gets that right quadrant, well, then we're
Yeah.
looking at something like this because depending on where that landfall is, the impact is a lot different in the various counties along the coast, depending on where the landfall is. I mean, we also have, I know we focus on District 9. They're located on the Gulf Coast. That's our huge focus. But we actually, in the last few years, have seen more need and issues when a storm actually makes landfall in southern Louisiana and tracks up like the Mississippi River area. So like that southwest corner of our state, they struggle
Right.
because they're not getting storm surge, but
Right.
they are getting hurricane force winds, tons of rainfall, all the things, deal with flooding, all those. They're not as prepared for that type of event as the coast is. The coast, they spend all year preparing for hurricanes. Okay. They know how to
Exactly.
handle it. They have the resources. That part of our state does not have those resources. And they also have part-time emergency managers. So like they don't have the same resources. So we have spent a lot of time working in that part of our state trying to build the coordination better, with some local like coalitions where we can really focus on things that impact them and how they can work together. to be better prepared with less resources because they just have less resources in that state, in that part of the state. And there's also not a level 1 or 2 trauma center in that part of the state. There's we're we have a new OB system of care in our state because we don't have enough hospitals that will deliver babies anymore. So that's becoming an issue. So there's lots of things that I think this at-risk registry, if we could kind of work together amongst the emergency managers and the Department of Health and y'all, that we probably could help alleviate a lot of our issues and help better plan to for those, because that would also help us know what we're caring for
I
so we can
promise.
make sure we have the things.
I will follow up with you after
Okay.
this call, and we'll start talking about the address registry, and I'll
Okay.
take you on a tour of it, because I think
Yeah.
it could benefit, especially, well, not just the coast, but it could benefit across the state,
Right.
for any. But I did have one other question for you, and that had to do with, say, the emergency, the medical shelter is open, and I know that you're going to have staff there. You have no objection to the agents, the patients that have agencies that have patients in your medical needs shelter, if they're there for an extended period of time, do you want those agencies to come in and take care of their patients post-storm, as long as the shelter's open?
So this was a huge question last year that came up, and legal got involved in all the things. And I believe what we came to was yes, we do,
Okay,
because especially if if it's an extended amount of time, like if it's a couple of days, we're handling it. But long term, yes. Now we have to make sure that we coordinate because we don't need them just showing up and them not knowing, because we have to make sure that the nurse manager is aware because they're the ones that we have to coordinate, with our doctors and things like that. So, and if there's certain things that it's not as big of a deal if they have a caregiver. If they don't have a caregiver, it becomes a
well,
little bit more.
I know CMS has expressed that if we're paying for patients' care, we expect the agency to follow up with that care, regardless of
Right,
where the
where
patient
they are.
may
Yeah,
be, especially after an emergency. So I just wanted to make sure that
yeah,
agencies understand that they have a responsibility
right.
to change the plan of care to follow those patients wherever they may be, and that may be in the shelter.
Yeah, and we can, work on that, and that would be something that in our command center we would be working to
Yeah.
arrange, and making sure that we could accommodate and everyone was there, and we had a roster of like which patient went to which entity. That would be something that we need to make sure we're capturing on the front end if they're coming as a hospice patient or a home health patient, that we know, okay, this entity, and I won't even try and say all the names because I know there's so many different agencies, but we know on the front end. That way we can say, okay, yes, this patient is
Right.
with this provider and they're going to come and do this tomorrow. That way we let the staff know, because our staff rotates every 4-ish days. So it's kind of the first staff that are there are a little bit longer because they're part of the setup and all that. But they kind of, we're gonna have new staff coming in if it becomes a prolonged shelter.
I really want to thank you
Yeah.
for giving us some time today to talk about sheltering for home care and hospice patients, especially along the coast. I do want to ask some of our participants who may have questions to open up your mic. You have to unmute yourself, or you have to put your question in the chat box. I've opened up a chat box. So if you're shy or you don't have a mic, you can put your questions for Ms. Smith in the chat box right now, or you can just unmute yourself and ask your questions.
And I also will put my email in the chat box. That way, if someone doesn't want to ask their question but wants to send me an email and ask a question, they can.
Thank you. I appreciate that. And
I
I,
know a lot of
I'll-
these facilities work with our staff because we kind of help with the emergency operations plans in the facilities or with the providers. So a lot of a lot of my staff know these people and work
Right.
with them, routinely to keep their emergency operations plan updated.
Thank you. We appreciate all the efforts to increase patient safety, especially
Yeah.
during emergency declarations.
Yeah.
Did I hear someone had a question? Well, I don't hear any questions, and I'm not seeing any questions pop up in the chat box. So I guess that's a good thing. People are clear. People have been taking their emergency preparedness plans seriously and making sure that issues are being addressed. Yeah. Okay. Well, I want to thank you both for your time today with this, and thank you for your presentation, Candace. I will be in touch with you so we can
Please do.
talk further about the at-risk registry in Mississippi. So thanks, everyone. We will be meeting again next Wednesday, same time, same station, to continue this discussion as we get even closer to the peak of hurricane season. In the meantime, stay safe, stay cool, and if you have any issues that pop up between now and then, you can always contact me at jboudreau@lmhpco.org or on my cell at 504-491-6133. Thank you. Thanks again for being with us today, and we'll see you again. Hopefully, only on Zoom and only in calm times. During no emergency declarations, at least for this year.
Yeah.
Thank you. Bye-bye.
Thank you.
Thank you.